My name is Will Calling. I'm the Head of Equality and Diversity here at the University of Wolverhampton, and I'm delighted to welcome Elsie Gayle to speak to us today. Elsie is not only an honorary graduate of the university, she is a midwife with several decades of practice, having practiced not only in Britain, but also in Jamaica and Botswana. She also co-chairs the Society of African and Caribbean Midwives and has been doing a lot of work about highlighting the enduring inequalities that black women, and particularly black mothers, face in the health system. So please join me in welcoming Elsie to talk to us today.
So thank you, Will, for that introduction, but also thanks to the university for asking me to reflect on the Windrush generation, the contribution to the NHS. And before I actually start talking, I just want to apologize to Bob Marley for the movement of da people instead of ja people. So just looking a little bit at the backstory, because the Windrush generation, as they are called, or as it is called, is not necessarily a one event that just happened in isolation to everything else. It came about as a lot of events and issues and travels, processes that were happening over hundreds of years. And really it began with the building of the British Empire. I've been doing quite a lot of reading, researching, engaging in terms of understanding. As Will mentioned, my primary work now is looking at the situation in my profession around maternity care and why it is that mothers of African descent are 4 to 5 times more likely to die as a result of their maternity care. And their babies are more than 50% likely to suffer a stillbirth and have high mortality rates in infancy. So it has helped me to understand the Windrush generation in terms of where it sits in the empire building of the Great Britain. So chattel slavery, as we know, went on, many hundreds of years ago, and it actually began with Europeans, including Britain, going to places in Africa to capture and to move people of African descent from Africa to the New World to develop colonies. And within that, what we have is the trading of people, the breeding of people, the owning of people, and the trading of people, selling and buying of people in order to enrich the coffers of Europe or European countries, and Britain in particular, as we're talking about that today. Then as slavery came to an end, there was still a need for a lot of labor to work in the colonies, the very different colonies. And what happened then was that people went back, the Europeans went back to countries of the South, so places like India, China, and again to Africa, to recruit labor. Okay, not under slavery terms, but certainly in terms of having very low wages. But these were people who were largely in need of work, in need of improving themselves economically and so on. So they were then brought to the colonies, as they were then known, to replace the slave labor that was, largely gotten rid of or sort of waned as the original slaves became free and were taking up other areas of working. And then as slavery, indentured labor came to an end and it became more important to be seen as developed nations, the colonies then became nations of the Commonwealth. Many of them were given their freedom in terms of becoming more, managing their own affairs. So places like Jamaica in 1962, they actually got quite a lot of their, they were able to develop themselves as a nation within the Commonwealth. Then we have people, as it is normally, you know, there are people who travel for education purposes. So for example, some of, my husband in particular, he came here on a scholarship to do engineering. Then we have residents who were returning, who were British citizens by birth and from England, Scotland and Wales, who had gone to the colonies, married, had their children, and they were returning. So they were part of the citizens here in this country. Then people of the diplomatic corps who were coming from elsewhere, working here and so on. And then we had people who considered themselves expatriates. So people who, for example, would come from other countries. So this is how Britain has actually managed to develop along the lines as we go along. So in terms of the Windrush now, how they actually got their name, I've had to do quite a bit of research, and I've put the reference that I've used, as well as the stories and investigations that have gone on, all the reports and so on. What I understand is that the Empire Windrush, which was perhaps the main ship that brought people from the Caribbean to England on the 22nd of June in 1948. It arrived at Tilbury Docks with 1,027 persons. And for many people who are looking at this issue of the Windrush issues, the generation, their contribution to the NHS and so on, this is like the main story. So who are these people and how did they come? You know, why did they happen to come here? So as you know, Britain, or you may not know, Britain was coming out of the Second World War with a lot of issues in terms of labor and structure. So it needed to actually rebuild a lot of the country. You know, a lot of it had been bombed. There was a lot of poverty, destitution, and so on. But also, they'd lost quite a lot of their workforce. And alongside that was the creation of a National Health Service, which was perhaps one of the greatest things that had actually been created by the Labour government in 1948. Alongside that, we had the British Nationality Act of 1948, which actually found that people in the colonies were British nationals, and it actually encouraged people to come who were British nationals to come to live and to work in Britain as if it was their own country. Alongside that, we also had economic migration, and then there were people, you know, the usual political migration, people who were having problems in their own country who needed to have refugee or asylum seeking status. So all these sorts of things were going on at the same time. So coming forward then into today, what we have is that the NHS remains the largest employer in Britain, well, amongst the largest employer in Britain. Professionally and occupationally, it remains one of the most diverse. So we have doctors, nurses, midwives, physiotherapists, psychiatrists, but also the other people who are integral to the running of the NHS and without whom the NHS would never function. So I'm talking about the people who cook the food for the patients and the staff, visitors and so on. We have the porters. I mean, they are actually some of the biggest or the greatest significant backbone of the NHS working. We have managers, electricians, builders, it could actually be a society in and of itself, in terms of how the NHS works. Of course, when people came in the Windrush generation time, and the Windrush generation time would be, say, from about 1948 to 1971, some people say, but some people actually extended to 1973 as well. So a lot of those people actually found work inside the NHS who were coming from the Caribbean. They were already British citizens, certainly in terms of the law, their birth sometimes, and they were able to find work inside the NHS. Most of those were having, they had lowly work, the sort of more manual labor type work, the vocational type work. A lot of women actually did some type of nursing. So there was auxiliary nursing, there was two levels of nursing actually. There was an enrolled nurse status, which was more of a practical nature. And then the state registered nurse, which was the professional nurse. Then we had midwives and certainly doctors. So a lot of those people actually began, they got work inside the NHS. And what we've found today is, although they have now largely, a lot of them are in their 90s, many of them have passed on, but their descendants, a large number of them are still employed inside the NHS, still working. What we do find though is that, and this is a source of discussion at the moment, or has been for a number of years, the NHS does not necessarily reflect, and in many ways seems to be not appreciative of some of the Caribbean workers in the NHS. So some of the images we see on the screen don't reflect the full scale of the NHS people who came as a result of the Windrush generation. And I've recently walked in one hospital where, I was looking at all the photographs on the wall down a corridor, and there was not one Black person in any of the pictures on the wall of that unit. Having said that, a large number of people working in that hospital were Black. And a lot of people actually are very, people have started to call these things out. Many people just get on with their day-to-day work. They're not complaining, but it is really interesting that the NHS has now decided to take steps to actually improve some of these issues, because what we find is that a lot of these issues, people were not really aware of them. They weren't conscious that they needed to be fair and allow people to be represented in some of the most important work inside the hospital, for example, porters. So have we integrated into the NHS? I would say yes, but at a much lower level in terms of workforce and aspirations. You hear about the glass ceiling in the NHS. What we find is that there's been a lot of band 5 nurses, band 6 nurses, and very few people actually rising up to be a band 8 managerial, or indeed sitting on the board, executive board, or indeed as a non-exec director inside the NHS. What we do have is a lot of people who are beginning to speak about the lack of the ability to rise in the NHS and to actually manage. Having said that, there are some of us who would prefer to be at the coalface working with our population. And that is really important, certainly in my perspective, because we understand the needs and the values at that level, and we're able to actually deliver services that I would call culturally safe services at that level. But we still need people inside the whole hierarchy of the NHS to enable for that to happen. So in terms of the health and well-being situation, what we are finding now, and certainly if I could use maternity services as a prime example, since about 2001, I've been actually looking very carefully at the situation for Black mothers and babies in this country as a result of maternity services. And what we have found ever since, certainly since 2001, is a disparity in mortality and morbidity. So even though it was happening, and I'm sure it was happening before then, because it doesn't just happen out of the blue, it has continued to be so, but not really well recognized until about 2018, when people are really beginning now to understand that there is a disparity, it is not fair, and something needs to be done about it. Underlying all of that in terms of health and well-being, what we do find is that we, people of the Caribbean, people of the Windrush generation and their descendants, actually have poorer health, poor economic situations. They struggle to achieve good educational spaces for their children. And if we look at the education, you know, when we look into education as a result of being able to access all the spaces for primary, secondary, higher education, university, and so on, and then to achieve professorships and so on. A lot of these people have had to go abroad, to the States particularly, in order to rise to the top of their field in whatever it is. So we, you know, these are the things that are actually coming to light. And we can't actually change anything until we actually recognize that something is not right, something needs to be done, and how do we go about it? That said, even though we have this situation where there are issues in terms of people being treated fairly and having good outcomes and good access, the international recruitment of people from the Caribbean continues. So we found, certainly inside the NHS, there was a 1948 recruitment of people from the Caribbean, who we call the Windrush generation. In the 1960s, people like Powell was on a recruiting drive. In 1998, we found that the New Labour went to the Caribbean and other places to do some more recruitment. And then again now, in this year, in actual fact, we find that there continues to be recruitment for the NHS in places like the Caribbean and so on. So, you know, it continues. We are still important in terms of supporting the labor force, supporting the NHS, supporting people to prevent illness, but also to heal and to support. So I just want to say thank you. So I am a registered nurse, a registered midwife. I am actually now a social entrepreneur in terms of maternity services. I'm an activist for mental health, because that is so important in terms of our health and well-being as people of African descent. And as Will mentioned, I was very honored to receive a fellowship from the University of Wolverhampton. But my alternative story is this. I am an expatriate. I'm a British citizen by birth. My parents were both British citizenship. So they were both British citizens. My parents came here. They did their training, their degrees, and then they returned. So they never came a part of the, they were not a part of the Windrush generation. And I do not include myself as part of the Windrush generation, although I absolutely respect and honor the people that did actually come. Because without them, I guess I wouldn't have a training, and I'm not so sure what would be going on in terms of the NHS now. So I don't know a lot about the Windrush generation in terms of what went on, except what I've read and what I've spoken to others about. A lot of the older people are dying, have died, and those stories many of those stories are lost, but we still have quite a lot of celebration, a lot of documentation. And this site that I've referenced here is one of the best sites that I've actually found to learn a lot about the Windrush generation and some critical thinking about what went on in those times. So thank you very much. I'm happy to take any questions that you might have.
Excellent. Thank you, Elsie. If people want to ask questions, please post them in the Q&A function or in the chat, and I'll read them out. Just a question to you from me, Elsie. I mean, obviously you came to the UK in the 70s, if I remember rightly. How did you find entering the NHS in the 70s? Obviously, this was a couple of generations on, as you say, from the Windrush generation, and so the what would have been called new Commonwealth immigrants at the time were a common feature in the NHS. But how integrated were Black and Asian staff members at that time?
Okay, so just a little bit about my entry to the UK or to England at that time. So my mother had come in the 50s specifically to do nurse training, and then she went back home. And I was looking for something to do with my life. So I thought, right, I'll just follow my mother. I'll go to England, I'll do my training, and then I'll come back home. When I came to this country, I went to her old training school, as a matter of fact. There are quite a lot of people from the Caribbean, from Africa, from Ireland, and the Philippines, interestingly enough. So there was quite a bunch of there was a mixed bunch of people in the hospital. Most people got on really well. There was a lot of, integration was there. I became Black when I came here, actually. I just saw myself as a person before I got, when I was in Jamaica. But it became obvious to me that I was Black when I came here for the first time, really and truly. I didn't really think about those things beforehand. And, reflecting as I've been doing my reading, looking at chattel slavery and things like that, what I realize is that I realize it now because I was busy having fun, meeting people, chatting, going out. What I realize now looking back is that some of the people were looking at me as different. They really saw me as different. And I remember very clearly one patient, a young woman, asking me if I was a half caste or a quarter caste. And I think, now I would say, and I really have something to say about that. But I kind of felt like, what was she talking about? That's a very strange thing to be asking about somebody. But I'd have a very different something to say about that nowadays. But yeah.
Yeah, interesting. Like I said, if anybody has any questions, please post them in the chat. As I'll read the first question out, which is: the NHS is the biggest employer of people from a Black, Asian, minority ethnic background. How can we encourage young Black men to work in other areas of public service, such as police, fire, Navy, Army, local authority? Do you have any thoughts on that, Elsie?
Yes, and I think my take on these things now is that there is still a lot of ignorance around these issues. And what we find is that a lot of the spaces are not, I would say, culturally safe. So there is an imbalance of power that is a problem. That is a problem in society. And we all have to want to do something about it. It cannot be just a one-sided thing, truth be told. And I think it is so in the NHS. And even though we have issues now rising around racism, racial bias, and these things, there is still a reluctance on both sides of the fence, I would say, on all sides of the fence, to recognize that we seriously have a problem, and not just one set of people. We all have to be able to do something about it. But in order to do that, we have to recognize that there is a problem. And I would say the same thing applies to the police force. And we're seeing a lot of issues of gender. I think we can all really get the issues of gender that are happening now, certainly in terms of the 2 deaths that have occurred where women have been murdered by men or ill-treated by men. So what we find is that, well, what I think is that we need to really examine these and have a good understanding of what's going on, what's happening for this person, why they're being treated like that, why they're behaving like that, what can I do about it, what is the problem? But cultural safety is a New Zealand nursing competence that I think is really, really quite important to consider, because it's really about power and shifting the power balance. And I think that is the problem. But we live in a hierarchical society. And when we look at government, even what we see is that people who've been to Eton, who are rich, I mean, these are the people that are thriving, so it's a really deep problem. And we can only do it together. It's not a one-sided thing.
And also, I think, just add to that, like, a lot of these institutions are more diverse than you would think, but because, it's the Snowy Mountains problem, but because the senior levels are so white dominated, you actually have to know a lot about those organizations and those institutions to realize they're so diverse. So if you're a young Black person, man or woman, girl or boy even, you may not realize that there is a career in public service, because actually the role models are pushed forward. The most senior people, the most celebrated people tend to be white. I mean, the one I have, other than higher education, I have some experience of is the army, because my ex-wife was a soldier. Army is incredibly diverse. Much like the NHS is still doing recruitment in the Commonwealth. They've just reopened applications for people who don't have British residency. But you only know that once you actually have some sort of association with the army and you actually interact with the army. Otherwise, it's completely hidden from the general public. You had a Secretary of State for Defense launching broadsides against immigrants, when it's like, well, over 10% of the army actually are immigrants because of things like the Gurkhas and recruitment from the Commonwealth. So I do think, in terms of organisations, not only is it right to remove glass ceilings and barriers to promotion, that also has that role model effect and encourages more people to come forward.
But the other part of that, you see, Will, is the culture of the organization. So there is something called internalized racism, Black on Black, and all this Black on Black crime and so on. There is something about the culture that needs to change. So it's not just removing the people or promoting Black people into these positions, because a lot of them, and if you go back to slavery, and this is why slavery is so important, understanding slavery is so important to how we move forward.
Yeah, I mean,
there were the hierarchies, weren't there? So you had some were employed to work in the house, and those were seen as better than the people working in the in the fields. So we still have that sort of behavior. A lot of people, Black people who have been promoted, still behave in the same way to oppress other people. So we need to shift the power thing. That is a real big problem.
Yeah, I think, and this is the point you make with things like cultural safety, isn't it? If you don't change the culture of organizations, if you don't change the assumptions made behind practice, a lot of those assumptions are very European centric, then actually it doesn't matter how diverse the workforce is, because you're just perpetuating old ideas, old ways of doing things that do discriminate against Black and Asian people. So I absolutely agree with that, Elsie. Got another question here. So Elsie, thank you for sharing today. I found this very interesting. That's such a powerful statement. I became Black when I came here. I respect you sharing your experience. I recognize you mentioned the NHS are now acknowledging and improving in terms of representation. However, I'd like to know what you think the NHS still need to do to improve on in terms of representation and inclusion.
That's a really tough question. The NHS is enormous. And if I can say, my focus now is on the bit that I can do. It's down to each and every one of us to make a difference. So for somebody like myself, I have absolutely no interest in climbing the career ladder, being at the top of any tree in maternity services. Where I know that I can make a difference is what I'm trying to do. So at this moment in time, I've been very fortunate to be given the gifts that have allowed me to set up a small midwifery practice. It encompasses people who understand what the issues are and what we need to do in terms of our work as midwives. None of us want to be managers or senior managers. We just want to work with women. And that is what we think, we know we can achieve that. So we just want to set up this little practice to look after 200 women in order to make, and these are women who have the worst outcomes. They're not always Black. Sometimes they're Roma. Sometimes they're Filipino. Migrants who have come on the boat who are pregnant. To look after 200 women, utilizing the best model of care known, which is continuity of care model, to journey with the women, to support them to birth well, so that they will in turn be able to nurture their babies and help to give a positive improvement to society. So going back to your question, it's a really difficult thing. I mean, the NHS is enormous, and you have to recognize where it is that you can make the best impact and go there. For some people, it will be managers. But for me, and a lot of us in our working, we recognize that this thing is too big to bite one. We have to take little tiny bites. And this is where we're sitting. We're doing a little bite where we can make a difference to the lives of 200 women and their families and the society in which they live or will be living.
Just a reminder, if anybody has any more questions, just post them in the Q&A. I'm just looking at the chat. And we had someone who said, you're an inspiration, Elsie. Thank you for what you do. Your presentation and conversation and insight help keep the conversation moving in the right direction. And they also mentioned that in their experience, diversity and inclusion in the police remains a problem, that sometimes they aren't responsive to issues that are raised in terms of their line of work. We have another question, which I think you've touched on, but I don't know if there's anything else to say. In terms of the NHS as an employer, has this improved? And what more can it do in that area in terms of actually supporting Black staff members?
Well, I don't know that the NHS has improved as an employer. And I say this because one piece of work that's actually attached to our little practice is supporting midwives who are Black and others, but primarily who are Black, who have been ill-treated, bullied, suspended, sacked, sent to the regulator maliciously. And in actual fact, I can tell you now, a couple of us are supporting our midwife who, she's a nurse midwife, significant clinical experience and knowledge. And she was brought here as an immigrant to work in the NHS, lost her job through maliciousness. And I can tell you that because I've seen all the paperwork and we've been supporting her through the regulator. She was destitute, sleeping on the floor of her church, on the floor on the carpet, no heating, no money, nothing. She lost absolutely everything. So this, as an employer, I'm not so sure that the NHS is getting any better. And the concern now is, if you look back to the previous slide that I had up, which is looking at the immigration, the international recruitment, we continue to recruit people from these countries. And then are we treating them any better? My mother, who worked in our NHS in Jamaica, what she would say is that a lot of the nurses who were trained there or here or in the States kept being asked to come to England to work, thereby stripping. I mean, so we are actually going out and stripping out some of the nurses and midwives and others from their countries, depleting their workforce. So, and then we bring them here and ill-treat them. So I'm not so sure that that is a good thing. I'm not so sure that they've even recognized quite what they're doing. On the other hand, we have work going on. So people like Roger Klein, who's developed the workplace race equality scheme. The NHS, there's a lot of policy around treating people fairly and working with people. There's the whistleblowing guardians and so on. But the practice is sorely lacking. Lots of policy, good policy, but the practice is still sorely lacking.
And what could be done to improve that, in your opinion?
Well, actually, I believe they really need to be holding executive leaders to account. And I think that's begun to happen a little bit. But I think we need more working on the ground with colleagues. So for example, proper critical look at the issues. And again, I refer back to issues of power and hierarchy and all those things. We live in an age of neo-colonialism, and the whole structure is not right. It works against us, but we actually have to take a fundamental look at how it is that we're treating people. And how important they are really to us, instead of thinking, well, I'll oppress this person, and I guess we don't think of it like that, but there's certainly a lot of bullying and harassment in hierarchical spaces. We need to kind of get rid of that and be working at a level. So, and I refer back to our little practice, what we have is just a straight, everybody's at the same level. Different people have different responsibilities for aspects. So somebody might be looking after engagement with women. Somebody else is doing breastfeeding or governance. And everybody's on the same level. We have equal power, so to speak.
And not to sound too much like a Marxist, but one of the things as well, if you think about not just seniority within the NHS, but also relation to like the means of production, there are aspects in an NHS where you're not an employer, you're a contractor, you have greater degree of independence, things like very senior doctors, senior surgeons, general practitioners. These tend to be the bits of the NHS that there are fewer Black people employed. Black people tend to be employed in the aspects of the NHS where it's more of that direct hierarchical employer-employee relationship. And so just by existing, things like your independent practice kind of create the space for conversations about different ways of working and different ways of treating people.
Yes, and I don't know a lot about Marxism, if I'm truthful, really. But what I can say is this: what would a doctor be without the nurses that were providing the most of the care for that patient? Well, how could he function without these people? How could nurses function without the porters and so on? These things are really, really important. But I guess the way doctors are trained as well. I mean, I've had to experience that from a trainee doctor. How they are trained. They're trained to be like at the top of the tree and not appreciative of the things that are important. It's.
And we saw this obviously during the pandemic, and you spoke about this last year to the university about, you know, a lot of the reasons why Black and also Asian people were more likely to catch COVID and a serious bout of COVID were because they're more likely to be on the front line because of these critical roles they're doing.
Yeah.
We have another comment in the chat. Thank you for your presentation. You are inspirational. I teach medics and clinicians. Many feel the concerns re the wide corpus of the NHS and levels of respect for Black, Asian, minority, ethnic, global majority employees have declined more since Brexit. Policy needs to be operationalised, but do you feel more inclusion of Black staff across all levels in decisions and initiatives is needed, and is monitoring effective in this?
We need everybody at in order to, the service needs to, I mean, this is what the NHS policy says. Services need to meet people's needs and values. Well, they're not going to meet anybody's needs and values if the people are not at the table. We all need to be present, or certainly have a voice or an impact that is valuable or valued, in order to be able to, you know, to create a service that meets people's needs and values. And it's really interesting just now because I have resisted becoming a governor of anything, but I've just become a governor, public governor of a trust that has declared itself an anti-racist trust. So I'm going to be looking really carefully to see what that means, because there's a lot of talk around these things, but you know, the action is thin, very thin. But the whole system, you know, the whole system has been set up from the cradle to the grave in terms of white British or British, and what is British really. So to actually break that down, it, you know, a senior midwife said to me, it will forever exist, which is why I think a lot of people are trying to move up the tree in order to make a difference. But there are other things that need to happen elsewhere, on the ground, in the middle, at the top, on the sides, in order to change things. But we all have to want to change. Education is really, really, really important, very important. And if we keep educating people in the same way, the systems are behaving in the same way, then we will never have any change.
Yeah. I think on senior representation, I'm always struck by the old feminist line, which is, if you're not at the table, you're on the menu. Which I think captures the issue. You know, if you're not in that key decision making room, then you're the one. You're the group whose needs can be sacrificed. Do we have any final questions for Elsie? Otherwise, we will end the conversation. I'll give it a couple of minutes for any further questions. But Elsie, would you just like to just go over again where people can find you, and what you're working on at the moment?
Okay, so my email is on the last slide there. Well, I guess they could come through yourself if they wanted to locate me.
Yeah, I'm more than happy
I do have a university email, which I use from time to time, courtesy of the university. And my work, I am very solution focused now, having had a long time to look at, to critically analyze, and been given gifts to build. We have a small midwifery practice, midwives who want to work with women who are not really interested in exiting the system. A lot of people leaving the system. We want to work in ways that are well regulated to give quality care to women, in particular, women who have the worst outcomes, and that in this country is a woman of African descent and her baby. So we're trying now desperately to get that on board. we're talking to some of the commissioners, local commissioners, to try and get that on the menu for the NHS. And thank you very much for having me.
And thank you for coming to talk to us. It's always a pleasure. And yeah, it's really important work. The maternity statistics are quite scary. You know, it's quite sobering to think that racism begins before people are even born, even in the year 2021. But big thank you again, Elsie. We've had no further questions through, but I think everybody's really enjoyed the talk. This will be available on YouTube in the near future, but please visit wlv.ac.uk/Black History Month for more information about the rest of our events over the course of October about Black History, and we'll see you again soon. Thank you, everybody, for joining. Yeah.
Kind of spreading out a little bit. So,